Welcome everyone to the webinar on Foundations of Establishing a National Digital Health Strategy. I am Mariel Kusa, the GHI Academy Division Manager. The Academy is the capacity building arm of the Global Health Institute at the American University of Beirut. This is the second installment of the eHealth program's webinar series on the role of digital health in strengthening health systems applications in low and middle income countries. The webinar will be delivered by Dr. Henry Mwanyika. Dr. Henry serves as PATH Center of Digital and Data Excellence Regional Director for Africa. With more than 20 years of experience in both the commercial information and communications technology sector and the public sector, Dr. Mwanyika is a trusted advisor to governments across Africa. In his current role, he supports government efforts to design digital health infrastructure. In particular, Dr. Henry supports the creation of roadmaps that support the design, investment, and implementation of end-to-end integrated digital health systems. Dr. Mwanyika was a key driver in Tanzania's effort to improve data quality and data use, directly supporting the government to develop the first digital health investment roadmap on the continent. In addition, he has led digital health work for PATH in Zambia, Kenya, and the Democratic Republic of the Congo. Dr. Mwanyika holds a PhD in health informatics from the Swiss Tropical and Public Health Institute at the University of Basel in Switzerland, and a Master's of Science in Business and Information Technology Systems from the University of Strathclyde in the UK, and a BSc in Computer Science from the University of the West of England. Dr. Mwanyika's webinar will be followed by a 10 to 15 minutes Q&A session. Please feel free to type in your questions in the Q&A box as we move along the presentation. Dr. Mwanyika, handing it over to you.
Yeah, thank you very much for the introduction, and hi everyone. Thank you for taking your time to join this webinar today. And so we'll be talking about foundations of establishing national digital health strategy. And I will also share lessons learned from Tanzania. So in my presentation today, I will cover, I'll just give a very high level introduction of what digital health is all about, the need for digital health strategy, and what are the main components of successful implementation of digital health strategy, and also what are the steps that we follow when it comes to development of digital health strategy. And then I will end up with some of the lessons that we've learned while supporting Tanzania in the great job that they did to develop their digital health strategy. So I'll start with the digital health introduction. It's just the use of technologies in the health sector. So the idea is that we are talking about digital technologies. In this case, we are thinking about that is broader than just ICT, because in the past, when we heard about e-health, it was more about the use of ICT in particular in digital health. And as we all know, digital health brings a lot of benefits, including increasing efficiency, also to improve quality of care, but also lowering of delivering cost of healthcare, just to mention a few. So I just give, again, just a brief, the evolution of the concept of digital health. It all started around 1970s, where there was an introduction of telemedicine, others called it telehealth. As the name applied, it was around telecommunication. And there was a concept of distance because it was about delivering healthcare when people are in two different locations. And in 1990s, when we started seeing introduction of internet, then the word, the concept of e-health came up. So it was all about improving of record keeping of patient records. And now we started seeing focus of healthiness and also prevention to rehabilitation. And we all remember in around 2010, there was a buzz, mobile devices, mobile mHealth. So everybody was talking about mHealth. So it was all around mobile devices. So it used to communicate with clients, to remind them about taking their medications. So it was all about adherence. And through that time, now a patient became a partner in the therapy. So it was some of the interventions on mHealth, it was two-way communication where we ask questions to clients and then they respond just to give us feedback. And around 2015, we started seeing the introduction of smart devices or Internet of Things. Now we started using the word digital health as a concept. So it was all about smart devices. It was beyond just ICT. And as I said before, digital health is not about ICT, it's beyond that. And as we are moving forward in this fourth industrial revolution, we'll see introduction of things like personalized medicines. And maybe in the future, we start seeing about digital doctor, not only digital health, where doctors will be able to predict using predictive analysis or artificial intelligence on what is going to happen to who, some of the clients. And also we can precisely personalize medicines because of gene sequencing and those kind of things. So now we are moving in a digital health era where it's no longer about ICT, it's no longer about internet, but it's about how can we use smart devices, Internet of Things, to bring together all this data and generate data about our clients. So as we move along, when we talk about digital health, there are three conceptual terms that I would like to introduce here, because the way these terms, conceptual terms are used, sometimes they may influence the way you develop your strategy and the focus and priorities that you set in your strategy. So there's, we've seen a lot about in the past, the word digitize, which is a process of changing from analog to digital. So in the past, when we collect data from our service delivery points and we send them to higher levels for data entry, so we digitize paper records and make them digital. So from analog, which is paper, to digital. Then we started seeing the concept of digitalization, where countries now are moving towards not only using digital to collect data, but they're now using digital to transform business operations. So instead of us just doing our business and then collect data and later on digitize the data, now digital becomes part and parcel of what we do. So instead of healthcare healthcare workers at delivery point entering data, instead now they document data. They document what they do to clients. As a result, they generate data. So we are moving away from having data producers to data users. So people document what they do, and then they use the same data to influence what they do next in terms of decision making and also service delivery. But also moving forward, now we are going beyond technology. So we are starting to hear a lot about digital transformation. So this is about changing our businesses in order to absorb or take care of, to utilize technology. So we are moving away from technology and now more on digital business maturity, where we have to look at the culture, we have to look at the infrastructure, we have to look at the way we do business and how is that influenced by digital. So we are moving away from digitalization or digitization now. The future is all about digital transformation, where we are going to transform our health delivery in order to embrace digital. So now we know about digital health. So why do we need digital strategy? So as we know that digital strategy is important because it provides a vision on how the health sector can utilize digital technology to improve health outcomes. So it's no longer about how we can collect data, but we need to have a vision on how we can utilize technology to improve health outcome. And also, it provides clarity on where the health system is going in terms of the vision for the future. And also, why do we want to get there? So what is the outcome that we desire? And as I said before, it's all about improving health outcomes and also improving patient experience. So also digital health strategy, it gives us a guidance on how we are going to design and implement digital health moving forward, because it provides us with a tool that we can measure the impact of what we do. But also when it comes to sustainability, digital health strategies, they're extremely key when it comes to sustainable digital health implementation, because we know when it comes to investments that we are going to put in digital health, we know why we are doing them and where will that take us in the future, so that we can measure the impact of all these investments. But digital health, by itself as a strategy, cannot be successful as a document. So there are some major components that are critical in the implementation of successful implementation of our digital health strategy. So first of all, we need to have a strategy. So our strategy will define why, how we are going to do it, and what, some of the elements. So this is the document that we are going to go through, and I'll provide some more information on the steps that we need to follow at a later stage. But also, most importantly, we need to establish governance structures. In this case, governance structures is not only about monitoring compliance, but the governance structures needs to be able to provide guidance on how people and how partners, whether implementing development, private sector, and also government institutions, can really comply. So it also is a support function as well, not only monitoring for compliance. But also we need to make sure that we can develop a costed investment roadmap, because this is important as it gives us a plan on how we are going to implement our strategy based on our country or department priorities. So it gives us a sequence of investments, how much it's going to cost us. So when we try to invest in digital, we at least know in which sequence we need to invest. So these are the three major components that if you want to have a successful implementation of your strategy, you need to have them in place just to make sure that, first of all, you have you know, why, how, and what. You need to have mechanism in place to make sure there's compliance, but also how things will be implemented moving forward. And most importantly, how much is it needed for us to invest in digital? So now I'll go through some of the steps that are required. And let me just point out that this is based on the experience that we've had in Tanzania, that the leadership of Tanzania that has given and shown in developing, and the steps that they followed. And we've applied some of these steps in other countries, and they're not exhaustive, and the order, some of the steps may be skipped, or the order may be changed. And it all depends on the ground situation, where the countries are, what some of the challenges they face, and where, in terms of maturity stage, a particular country is at. So the first one is you need to perform holistic situation assessment. And here is you need to identify factors that are beyond health, things like cultural, political, infrastructure, HR, and existing environment. So you need to look to assess where you are, what are some of the challenges you face, and some of the existing situations or ecosystem in your country. So once you do that, and now you need to determine the health sector challenges and priorities. In this case, you need to know what are some of the challenges the health sector in a particular country, in your country, you are facing. What are the challenges? And what are the priorities for the next 5 years? And once you determine that, now you can identify, based on those challenges, how can digital help you address those challenges or overcome those challenges, so that you can at least identify areas where digital can really help. Others may be other interventions that are beyond digital, like policy change. But you need to identify where can digital really help you address some of those factors. And also another area that is critical is you need to determine your vision for the future. So what do you want to see? What is the future that you desire? So that when you get there, you at least know that you've been successful or not. So that is what we say, that you have to set your vision for the future. And also you need to identify guiding principles. And this is critical because at the end of the day, when you're doing implementation, you need to have an assumption, or you need to have some principles that that will guide your future investments and also implementation of your digital health strategy. A good example, in other countries, they may say, we want to focus on digitalization, which means we don't focus on providing data entry systems or data collection system. Instead, what we're going to focus on is how can we utilize technology in order to improve our processes, or building from existing initiative instead of building anything from scratch. Also, you need to identify strategic priorities and come up with strategic initiatives. In this way that you will be able to determine what needs to be invested on when you're developing your roadmap, but at least you've identified your strategic priorities that digital can help you support. And as I said before, one of the pillars is all about investment roadmap. So once you have your strategy, then you need to start developing, in the old days, we used to call it implementation plan. But now we're using more on investment roadmap because it provides a sequence of where you want to invest based on your priorities. So some of the things that, because I wanted to share the slides just now in terms of what are the critical to-dos. One of them is stakeholder engagement. This is extremely important because you need to have different viewpoints, people to be committed, buy-in of all stakeholders within and outside the government. Most importantly, you need to get a buy-in also from senior government officials. This is important because at the end of the day, when senior government officials make investment decisions, they need to understand what are they going to get in return if they make a certain investment. So to get their commitment and buy-in is extremely important when it comes to successful implementation of your strategy. Also, involve governance structures. If they don't exist, you should establish government structures and mechanisms so that when decision needs to be made, at least we know where those decisions should take place. Also, the leadership should be from data or business, not ICT, because the idea is to make sure that this initiative of developing digital strategy is not seen as an ICT initiative. Because once it is seen as technical, you're going to lose business people. Another one is consultation. I just want to emphasize this. Consultation is critical. You need to consult with wide range of stakeholders just to make sure you get different viewpoints and also obtain buy-in from as wide range of stakeholders as possible. Also, learn from trends and experience. What is going on around the world right now when it comes to digital health? And how can we leverage that to improve how we are going to utilize digital health in our country? Also, communication with key stakeholder, frequent communication. You need every stage to make sure that you keep people aware, your stakeholders aware of what is going on. Because sometimes we have a tendency of initiating digital health strategy development and disappear for 6 months and only to come back and people have forgotten about that initiative. We need to stay engaged with stakeholders and communicate on the progress that has been made with stakeholders. So in general, that is the process and some of the critical to-dos when it comes to development of digital health. So in Tanzania, so now lessons. So Tanzania has just launched, I think it was last year, end of last year, they launched their 2019-2024 digital health strategy. And this came to replace the e-health strategy that ended a year before, 2018. As you can see, the name, it was from e-health strategy, now is digital health strategy. Before they embarked on the development of digital health strategy, they did an assessment of the previous strategy, just to learn what worked, what didn't work, and to what extent there's been successful in the implementation. Also, to take lessons from this assessment in order to inform a new strategy. And it was aligned with existing policies. So like National Health Policy 2019, Tanzania Development Vision 2025, National Health Sector Strategic Plan 4, 2015-2020, and other policy documents that they did, like the previous digital strategy, as I said before, investment roadmap, ICT policy, so many policy, and they had to make sure that it is aligned and complement those policies. Also, borrowed guidance from WHO ITU e-health strategy toolkit, which was developed in 2013 by WHO and ITU. Also, the process was very participatory, and they involved wide range of stakeholders from government, and in government, not only at national level, but all level of the health system, and also other stakeholders, training institutions, development implementing partners, private sector, ICT experts from within and from the region. The idea is to make sure that we can get as wide a range of viewpoints and also inputs as possible. Also, the process for Tanzania was led by business meaning people from the health side and data, not ICT. And that made it, that increased the buy-in from the sector, so they did not see it as an ICT initiative. And the focus of the strategy is health sector, not Ministry of Health, because we've seen in many countries they are developing digital strategy for the Ministry of Health. But in Tanzania, it was all about the health sector. Even the language was all about it's of the business and not digital. So even if when you read it, it speaks more on the health side, not digital. It's not technical, but the idea was to make sure how can we attract a business and to make sure the business see themselves in it. And one of the areas is for each of the strategic priority, they also outlined what we called capabilities unlocked, meaning for each strategic priority, what will be the expected outcome if that priority is successfully implemented? What are we going to see in the future? And that was very critical in order to measure, not only tick a box that we've implemented something, but how can we make sure that we can say we achieved the outcome that we expected? So that was very critical. And governance structure was specified, TOR were developed in the strategy. And that was critical, that we can always go back to the strategy to identify how is this strategy going to be governed when it comes to digital health. So that was the process, and the outcome of that was a strategy that speaks more about the health sector, not digital, as I said before, which was very critical in this case. So the strategy in Tanzania, it came up with a vision, which was to have a vision is to have a better health outcomes through digitally enabled health system. And the mission was to accelerate transformation of Tanzanian Tanzanian health system through innovative, data-driven, and client-centric, efficient, effective, and integrated digital health solution. So the strategy itself is all client-centric. How can they improve patient experience? And they came up with 5 strategic goals, 10 strategic priorities, 48 initiatives, and 31 capabilities unlocked. So I'll go through strategic goals and I'll put for the strategic priorities. So the first one was about strengthening digital health governance and leadership. Governance and leadership is extremely important when it comes to successful implementation of digital health strategy. So some of the governance structures existed. So now in this digital health strategy, the idea was to strengthen those. Another one was to make sure that health providers and managers are empowered to take evidence-based actions. The idea is to make sure not only to make data available, but how can we empower health providers and managers to take evidence-based actions. So having data is one thing, but making sure that people can utilize those data for evidence-based actions is extremely important as well. As I said before, it was all about improving client experience. So one of the goals of this digital strategy was to improve client experience through efficient provision of quality healthcare. So we won't be successful if client experience is not improved. And how can we improve that is by making sure that there's efficient provision of quality health service, not only just health service, but we need to improve the quality of the health service. Also, how can we ensure sustained availability of health resources? And in this case, health resources will mean commodities. How do we make sure the health system is funded to avoid leakages, and make sure also we have human resource that will be used, qualified human resource to deliver. And one of the areas that's of critical importance is make sure they're equally distributed across the country. In a country as big as Tanzania, we need to make sure that we have availability of human resource across Tanzania, not only in certain parts of Tanzania for equity. And also, how do we make sure that we have standardized information exchange? We have many systems and we don't have to have one mega system, but how do we make sure that we have standards in place that can facilitate effective information exchange through interoperability or other means? So the following are some of the strategic priorities. So they came up with 10 strategic priorities. And if you can see the language used, even each strategic priority is not about technology. It's about what we're going to achieve using digital health. So for example, number 1 is to strengthen digital health governance and leadership. To facilitate better coordination and implementation of digital health initiatives. So how can we strengthen digital health governance and leadership? The idea is we need better coordination. Another one is about improve efficiency, patient safety, quality, and continuity of care through digitalization of health service delivery. As I said before, the concepts that I talked about before about digitalization, digitization, I think here is reflected that Tanzania is moving towards digitalization of health service delivery. Enhanced use of digital technologies to improve health worker competency is extremely important. How do we ensure that we can provide specialized care to underserved facilities? How do we also ensure we promote healthy behavior by through access to relevant health education and information? Also enhance information exchange, seamless and secure, improve data use for evidence-based actions. And we talked about availability of resources, so supply chain management of health commodities. How can we improve those? Also, how can we improve management of human resources and also management of financial resources? And also, how can we strengthen disease prevention, surveillance and detection, reporting and response control? So as you can see, it provided a wide range of priorities. And then the next stage that Tanzania followed was to come up with strategic initiatives for each of these strategic priorities. The idea is to provide some examples on how can we utilize digital health and how can we come up with some of the initial strategic initiatives. And those were based on the previous era strategy and where the technology trends are right now. So that is Tanzania digital health strategy. One thing that which was very successful in Tanzania is that the language used, as I said before, and also how the driving factor was not about how can we utilize technology, but the driving factor was how can we utilize, or how can we improve patient outcome, how can we improve patient experience in order using technology. So the strategy is all about patient experience. It's all about how can we improve efficiency of the health sector. So I'll end there and I'll be ready to take questions. Thank you.
Perfect. Thank you so much, Dr. Henry. So we are open to taking questions from the participants. So you can type in your questions in the Q&A box. And yes, thank you so much, Dr. Henry.
Thank you.
So I think while we wait, Dr. Henry, would you be able to kind of give us your key takeaways on like kind of key pointers on from your experience on developing a national digital health strategy? And then after that, I'll start taking questions from the participants.
So one of the key takeaways from my perspective was mainly that, even though it's called digital health, but the driving factor is all about what is the outcome that we desire. In this case, the outcome was about patient experience. But in different countries, they may have different outcome that they desire. And some of them, depending on the maturity level of countries, they may say, we just want to, first of all, have in place governance mechanisms to make sure that, we coordinate better. So that can be the first, the outcome that we desire. But others, like in the previous strategy, is all about, we want to build foundation that in the future, all systems or all digital solutions can build on. So the outcome that we desire may drive some of the decisions that you make when it comes to coming up with strategic priorities.
Thank you so much, Dr. Henry. So I'm going to get started with the questions coming in from the participants. So the first question is from Juan Herrero from Chile. He has a question around the specific outcomes of the digital. What are the specific outcomes of the digital health strategy? And are you targeting chronic diseases, for instance?
Yeah, thank you. That's a great question. So in Tanzania, they took holistic view of the challenges. So it was not focusing on a specific disease or a specific program. So it was about how can they take holistic view of service delivery. So it was all about service delivery, integrated service delivery, not on a specific disease or specific program. So the idea is to how can they improve primary healthcare so that they can efficiently deliver health services.
Thank you. So the next question is around, would you be able to share the key challenges that you face while developing the digital health strategy?
Yeah, so one of the challenges, first of all, to make sure that you get buy-in from a wide range of stakeholders, because not everyone believes that developing a document will bring the outcome they desire. So how do you ensure that you can obtain stakeholder, you can engage as wide range of stakeholders as possible? That's number one. So you have to convince them that this process is worthwhile, because locking yourself in a room and come out with a document may not bring the outcome that you desire, which is a buy-in from all stakeholders. So that's number one. Number two, also, with all these technological changes, how do you pick and choose which ones are more or less excitement? So we've heard a lot about artificial intelligence, and if you're not careful, your digital health strategy may be all about artificial intelligence. So how do you make sure that you can pick technology and you can cope with technology advancements and move away from all this excitement about new technologies? So that is also a very critical aspect. One aspect is, how do you support countries to lift up? Because it's very easy to talk about specific disease, to talk about specific program, but how do you ensure that all programs can see themselves in these strategic priorities? Because sometimes people want to see certain buzzwords like telemedicine or HIV, but how do you ensure that you can achieve your objective of coming up with strategic priorities without mentioning specific technologies? Because once you do that, then that is not a digital strategy. That's not a strategy. That can be implementation plan. So how do you allow people to lift up and lift them up so that they can move away from specific buzzwords like telemedicine or others? So those are what I can mention right now.
The next question, would you be able to give more specific details on the actions that were taken to increase governance and leadership?
Yeah, so the first one is to have very clear governance structures with clear mandate, with very clear terms of references, and make sure those governance structures are empowered to be able to do their job. So that's number one. How do you have very specific governance structures with very clear objectives? But also, how do you look at existing structures, and instead of creating yet another governance structure, but enhance those or improve existing structures or strengthen those? That's why you see, it's very easy to come up with another structure. But for Tanzania, they decided, you know what, let's look at what exists and then build on those.
Perfect. So we have several questions, but limited time. So perhaps we can go over these quickly. So the first one is, can you please provide an example on how did you engage stakeholders? And just to add on another question that's similar, and how were you able to reach a consensus on the different choices and processes?
Yeah, the first one is through dialogue. There's a phrase we call partial agreement. So it doesn't have to be 100%, but sometimes, majority wins. So it was all about dialogue and also meet in the middle, reach consensus.
Perfect. So another question. So in a country like Lebanon, where their healthcare system is highly fragmented, what is your advice in order to approach healthcare decision makers to initiate discussions about digital transformation? What type of awareness can be done? And
all,
in terms of digital technologies to improve health outcomes?
Yeah, so first of all, I think you need to have a pull and push. So you need to have people to meet in the middle. So it's a hybrid. You speak to policymakers and also people who are doing the job on a daily basis. So you create demand at the lower levels, and also you stimulate demand, you create awareness at the high level, so that when people at the service delivery, they speak to policymakers, at least policymakers understand what is the potential, but also decision makers can see the value of investment, because that is the most important aspect. Where do I get return of the money that I put in? So we need to create awareness on the potential of digital in improvement of healthcare, health outcomes.
So these are two questions. So first, does culture has to do with digital health adoption? And assuming that most of the solutions are developed by the private sector for the public sector, so for sustainable digital health solutions, what should be the core role of the government?
The government should be involved in making sure, in creating enabling environment where the private sector can strive, and also making sure that what the private sector brings in can not only benefit the private sector, but also brings value to the government and the health system as a whole. So it's all about value addition, creating enabling environment, and creating awareness to the government officials in terms of how can they govern what the private sector brings in, so that it's win-win situation. And it's not about culture, I would say, it's about awareness. So if people will know what value do they get in return by going digital, they're likely to buy in. For example, healthcare workers, if they know by going digital, they're likely to go home early at the end of the month instead of them sitting down late at night with calculators to do some tallying from the paper records. So it's all about value. What do I get in return?
Thank you. Next question. Can you please elaborate on how donor funding could effectively support the Tanzanian government without undermining its ownership of processes?
Yeah, so the government has to be on the driver's seat, and through the governance structures and leadership of the government, we've seen donors aligning to government priorities. So first of all, you have to set your priority. And once you set your priority, you have to communicate that priority to all your partners, being development or implementing partners. And also, we need to have in place guidance, readiness of the government, and create enabling environment for people to communicate with the government. So it's all about having governance and leadership of the government, and put government on the driver's seat so that others can align on. Having a digital strategy is one of those steps, and also having investment roadmap is a move in the right direction.
We're going to take just the last questions. So what were the challenges in implementing the digital health strategy in Tanzania? And how was the challenge of interoperability managed? So building one system to analyze data emerging from many types of electronic health records.
So the first one, the challenge was all about readiness. So in the previous strategy, it was our first strategy in Tanzania. So aligning partners and making sure we are all aligned to one strategy. That was the challenge at the beginning, but now there's awareness. We have a very strong governance structure, and also the government is on the driver's seat. And the challenge about putting all the data together for analysis in the single place is all about standards. Because if you have different systems that cannot communicate with each other, they're using different standards, you won't be able to bring all this data together. That's why in one of the strategic priorities is all about information, enhance seamless and secure information exchange, because that will get us to be able to bring all the data together and create value, and also to allow the data to tell us a story by making sure that we can bring in different data sets to enhance the analysis. So it's all about having standardization across the systems.
So next questions. At what level were the highest strategic decisions taken about the digital health strategy in Tanzania? Was it debated in Parliament?
So Tanzania, we've enjoyed the highest level of buy-in from the government. And I'm talking about right from the president, who's talking about, how can we utilize digital health, right to the healthcare workers in the dispensary. So we've always enjoyed that drive, from the highest level. And you'll see in Tanzania, even member of parliament are pro-digital, and they really support, even including the minister who is a member of parliament, is always talking about digital. And if they sit in front of you, you won't even know that they are not ICT gurus, because they understand what digital health can do, and they're able to explain in a very layman's language. So yes, it has obtained a buy-in from the highest level, even to the lowest level, meaning the lowest level of service delivery. So everywhere, including the parliament.
Could you please share with us more about your strategy on improving data use culture, and what are the specific goals or initiatives that Tanzania had in its strategy?
So one of the areas of improving data use culture is, first of all, having in place change management strategies that will help people understand the value of data. And that will increase quality of data. But also, how do you intervene? Because if you look at how do you make sure that people who are coming out of training institutions already, they appreciate data. So one of the interventions was to update training curriculum of healthcare workers to make sure it prepares them to become data users when they finish the education. Also, how do you ensure that people can be supported from within their district to utilize data? And that data is available. And we have tools in place for them to be able to make decisions and utilize those data, instead of having data defy gravity. It goes up, but it doesn't come down. So how do we make sure that data can be utilized and used at the point of generation, not collection, at the point of generation, and make sure healthcare workers, they don't become data producers, but they became they don't become data entry clerks, but they become data producers as a result of the good work that they do. And also they utilize the data that they collect to make decisions at the point of care.
Thank you. So the last three questions I think are very related. So I will just say all of the questions at once. So first, how do you ensure that the strategy, that the governance structures and commitment are maintained throughout political environment dynamism? And what do you think are the main challenges of implementing digital health strategies in countries characterized by fragility? And the last question is, are there any sort of prerequisites or existing infrastructures that have to be integrated in the health system to be able to proceed with establishing a digital health strategy?
Yeah, so on the first question, is all about awareness, and the more people are aware of what digital health is all about, the likelihood of continuation. And we don't have to focus on political leaders only, but also focus on building the capacity and awareness of people who are using the data, healthcare workers, because most of the time those don't change when it comes to political changes. But when it comes to how do we set prerequisites, when it comes to have in place, is number one is to make sure that we have enabling infrastructure. So in places where there's no electricity, there's no communication, how can we use solutions that will allow to function even though there's no power or internet connectivity? So we can use things like tablet. So in terms of fragile places, I think that's where now you need to ensure that the investment you make in the strategic priority and initiatives that you put in place are relevant to the environment in which you work on. So these solutions, this digital strategy has to be relevant to country specific environment. So it's not one size fits all. It's something that it has to be specific for each particular environment.
Thank you so much, Dr. Henry, for providing us with a comprehensive overview on establishing a digital health strategy, and for sharing your extensive experience. I've already received really positive feedback from the participants, so thank you so much for your time. As for the webinar series, I'd just like to mention that the last webinar will be taking place on March 3, and it will be on the global state of digital health in 2020. I'd like to encourage you all to register for that if you haven't done so already. Again, thank you so much, Dr. Henry, and looking forward to collaborating more in the future.
Thank you very much. Thank you very much for joining, everybody.